Let's take you now live to the JoyNews National Dialogue on Clean Air. My colleague Benjamin Akako is addressing the media.
Hygiene and, of course, climate change. But how about the air quality we breathe? Today we're having a conversation focusing on air quality. In the past year or two, we have had conversations on the poor air quality in Accra and other places in Ghana. But this is also seasonal, as we know it. Currently, the levels seem to be appreciable, but there have been times when, unfortunately, we've rubbed shoulders with some of the most polluted cities across the world in terms of the quality of air. According to the World Health Organization, about 28,000 people die prematurely in Ghana every year on the back of poor air quality. And that's why today we've assembled representatives from different political parties to join us for a conversation on air quality, what their party's manifestos, what the plan, the agenda is, and whether we're going to be seeing better air quality, especially considering that there are a lot more vehicles on our roads and a lot more industrial activity that leads to air pollution, and it affects all of us. Welcome aboard wherever you are. You're live on Joy News. We're also live on Joy 99.7 FM and, of course, on social media, all our social media platforms, myjoyonline.com. Before we get into the salient issues, before we get into the nitty-gritty, I'd like you to watch this video on air pollution.
Air pollution is now the second leading global risk factor for death. This shocking data comes from a UNICEF-backed report in collaboration with the Health Effects Institute. The numbers reveal a grim reality. In 2021, air pollution killed 8.1 million people, translating to about 22,192 deaths every day. Even more heartbreaking, one child dies every minute due to air pollution.
The statistics are stark. The last report that was released on the state of global air quality showed that there were a little over 7 million deaths from air pollution-related diseases.
The biggest culprit is Ghana's aging, highly polluting fleet of vehicles. A sea of cars crawl bumper to bumper, thickening the air with harmful particles and gases. It's rush hour, a bustling time when everyone is on the move, crowding into public transport vehicles to reach their destinations. For those navigating this daily ordeal, the respiratory strain is palpable, with each breath laden with potential health risk.
It's not easy. It's a difficult moment, especially something that relates to your breath. You can't breathe as you do so often. It's challenging breathing.
Ruben Alexander Otu has asthma, a life-threatening illness that constricts airways. He's one of a growing number of Ghanaians with respiratory illness and a range of ailments, including heart conditions that doctors say are worsened by toxic air. Otu has to think all day, every day about avoiding triggers.
You encounter different kind of cars with the smoke from their exhaust pipes, very bad, and they are not the best.
70% of daily commuters in Ghana use privately run minibuses known as trotros, which are often older, higher emitting vehicles.
We give it to them to wear. Okay. The idea is to wear to where their nose level is. Okay. Just to see whether what they are breathing in will be the same as the Satan is speaking.
Researchers at AfriSet, an air quality research organization, are studying commuter exposure during rush hours using wearable mobile sensors. The preliminary results, according to James Nimo, a research associate at AfriSet, are startling.
From the raw, we could see that people are exposed to poor air quality, I think from 40 milligram per meter cubic to 100 milligram per meter cubic, which is above the Ghana EPA standard. So rush hours are around 80 milligram per meter cubic, which is not good for human health. So from the graph, you could see that from between 6 and 10, we have some peaks between 6 and 10. We have some values, the peaks, right? It's above that, and then in the evening, right, it can go up to almost 100 micrograms per meter cube.
Ghana's transport sector, made up of 3.2 million vehicles as of 2022, is the leading producer of air pollution. Pollutants from the transport sector alone account for nearly 40% of the country's air pollution, dwarfing the contributions from industries at 11% and households at 10%.
I do not get a straight car to work, and I don't have a car at the moment. So what I do is that I join one car to Kaneshi, then from Kaneshi I join another vehicle from Kaneshi to my station, then just a walking distance to my office.
Chief reporter at Ghana News Agency, Edward Aqua, was among the few volunteers on the project, documenting his daily commute from Abelinkpe to Accra Central. According to sensor data, pollution levels range from moderate to unhealthy for sensitive groups on average. However, during several segments of the trip, the pollution spiked to severely polluted, posing risks even to healthy individuals. Edward admits to feeling a deep sense of helplessness after witnessing these alarming results firsthand.
It was very disturbing because that is something that invariably I find myself in that way because that is my natural environment. And it appears that apart from you protecting yourself personally by way of nose mask, you cannot do anything much to stop the pollution because it's your natural environment, your natural routine. For me, it's very, very disturbing because it's a daily thing and you cannot go without it.
The WHO estimates 28,000 people die prematurely every year in Ghana as a result of air pollution. Between 2020 and 2023, the Ghana Health Service's own non-communicable diseases control program documented over 230,000 new cases of asthma. Epidemiologist at the University of Ghana, Dr. Reginald Kwanzaa knows why.
Air pollution levels are consistently moving up. There are several factors that account for this. I think one of the things that is very obvious is emissions from vehicles.
The good news is that there are things people can do to reduce their exposure. Dr. Carlos says the easiest is to wear a good mask.
Within the limitations of some of these protective equipment like the respirators, the N95, at least you can reduce the black carbon and then other particulate emissions.
Desmond Appiah, country lead of Clean Air Fund, insists that enforcing air pollution laws is essential to protect ordinary Ghanaians.
In the Ghana situation, we have some laws, but there's a lot more that we need to be doing to be able to push the needle. The challenge, large challenge that the clean air field faces is that the quality of the air is not seen. So we call it like a silent killer. We are in a room, we are breathing air, but we may not see that this is the state of the quality.
AfriSet, led by Dr. Alison Felix Hughes, plans to conduct extensive research across diverse socio-economic backgrounds and geographic locations to identify environmental hotspots nationwide.
Looking at the future, what we intend to do is to do a more detailed study over a longer period, looking at different groups of persons, students, workers, market women, and different groups, how the level of exposure is to these various groups as they move to and fro every day.
The EPA and other government agencies, including Parliament, are actively exploring various regulations aimed at strengthening air quality laws. This story was a collaboration with New Narratives. Funding was provided by the Clean Air Fund, which had no say in the content of the story. For Joy News, Michael Ashale.
And that report painting a picture for us. So how concerned are you, those of you live following the discussion about the air you breathe? And especially for someone with, allergies, and I don't want to go into further detail. This is crucial to some of us, because when you go out there and the road is dusty, it's not been completed in years, you are inhaling trouble wherever you go. Even if you've rolled your glasses and all of that, you will have to come out at some point. So what does that mean for all of us? On behalf of the multimedia group JoyNews, to be specific, I'd like to welcome all of you aboard the conversation, and also to acknowledge the Clean Air Fund and Breathe Cities for supporting us with this project, ensuring that we can bring you this all-important coverage. I would also like to acknowledge some of the guests from the political parties who are here present, who will be joining us for a conversation later. Professor Martin Oteng Abibio, he is chair of the NDC's Manifesto Subcommittee on the Environment. Thank you, sir, for joining the conversation. Courage Nobi, he's very outspoken on some of these matters. He's the spokesperson for the Movement for Change. Courage, thank you for joining the conversation. We also have Issa Abdul Salam. He is the CPP's Ashanti Regional Secretary. He joins the conversation as well. Thank you, Issa, for joining the conversation. We'll get a representative from the New Patriotic Party to be announced to all of you shortly. The last time we had Dr. Henry Kwabena Kokofu, and we're going to have a representative from that end joining the conversation. Some of our other guests joining the conversation, just to acknowledge them: Dr. Sandra Kwateng Owusu, Senior Lecturer, Department of Child Health, School of Medical Sciences at the KNUST. Thank you, Doc, for joining the conversation. Professor Kofi Amega, he is Vice Dean, School of Public Health at the UCC, University of Cape Coast. Thank you, sir, for joining. Dr. Elvis Trejabo, Portfolio Manager, Clean Air Fund, Breathe Cities. I saw him. Yes, there you are. All of them joining this conversation. Let me also acknowledge Desmond Apia, Country Director, Clean Air Fund. Thank you, sir. And Vibeke Pedersen, the Deputy Ambassador for the Danish Embassy in Ghana. Let's put our hands together for all of them. Thank you so much for joining the conversation. So on that note, we veer into more detail, and I'd like to invite forward to deliver some remarks the Country Director of the Clean Air Fund in the person of Desmond Apia. Ladies and gentlemen, let's welcome Desmond. We can do better with the clapping. Thank you.
Thank you very much, Ben, and it's a privilege to be here to discuss this all-important topic. Your Excellency, honorable members of this meeting, representatives of the political parties, World Bank rep, among others. Clean Air Fund was set up in 2018 with a singular goal to work for clean air for all. And I always like to repeat for all, because all of us breathe air. And so it's important that we work for all. For this particular program, within our system, we had themed it Unifying for Clean Air, because that is a common denominator. It doesn't matter our political ideology, the parties we want to support, to win, not to win. The common factor is that all of us breathe clean air. Clean air is what we hope to breathe. But in our society, some are more vulnerable than others. And so when it comes to the issues of clean air, we should be deliberate about how we tackle the causes so that we can be able to achieve the goal of everybody, irrespective of where we are, where we live, where we work, where we move to have access to clean air. So what we intend to achieve by this conversation is for us to hear from our parties the deliberate interventions that they want to be undertaken. Because we have looked at all the manifestos from 1992 to this point. If our key sources of air pollution are transportation, as the video was showing, waste, energy for cooking, farming, industrialization, we have heard all the parties talk about their interventions to tackle the challenges of our time. But we have to be deliberate. We have to be conscious that we do not try to solve one challenge but create another. And so we are seeking deliberate interventions. We are also conscious that in our country, there is very little demand for clean air. The work that Clean Air Fund undertook before it was set up in Ghana showed three key things. One, there is a will politically. If you look at our laws, there are quite a lot of laws which talk about air quality or which show that we have the aspiration to breathe clean air. But the implementation of same has been missing. If we look at our industrialization agenda that is being espoused all over, we have to show that we don't just want to industrialize and create more pollution, because we have seen it in other places around the world. What is our land use planning propositions and its impact that it would have on us? Are we being conscious to be able to address the peripheral issues that come with all the propositions that we are making? And if we are concerned about the pollution, we would say that where you put your money is where your heart is. What is our resource allocation towards tackling these particular challenges that we are facing? I would end here, Ben, by just re-emphasizing that what we are looking for is for deliberate, focused, intentional policies and actions that would have the potential to solve the challenges of our time, employment and the like, but would improve the quality of air, mitigate climate change, and help us to live better lives. Thank you very much.
Thank you very much, Desmond, for setting the pace, for kickstarting this conversation. Desmond Appiah is Country Director for the Clean Air Fund. Is there anyone here who breathes anything other than air? If you do, show by hand. Oh, so we all breathe air. So depending on how clean the air is, we are all impacted. You could be hiding in your air-conditioned office and all of that, but you have to come out at some point. And when you come out, you face what everyone else faces. I remember at a point, and I believe it's still the case, the Old Fadama area, considered some places, the Agbobloshi area, considered to be one of the most polluted, if not the most polluted place on planet Earth. And even the air in that place, because of the number of vehicles coming towards the market, leaving the market, exhaust fumes, if you go there, you're also suffering same. So what are we doing about those? I'd like to quickly acknowledge Aula Sewa. She is a major voice in the eco-conscious citizens. Aula, can you give us a wave? Let's see you. She likes to hide, but she's one very important person in this conversation. So moving on from here, I'd also like to take some quick comments, and this time from the diplomatic corps. I'm talking about Her Excellency Vibeke Pedersen, Deputy Ambassador for the Danish Embassy in Ghana. Please, let's welcome her.
Thank you very much. Thank you. Good morning. I would like to thank JoyNews and Clean Air Fund for inviting the Embassy of Denmark to participate in this national dialogue on clean air. I'm very pleased to be here today to affect an issue that affects us all, air pollution. The poor air quality in Ghana is caused by, among others, cooking using wood and charcoal, road transport, a significant contributor, as we just saw, slash and burn methods of farming, open waste burning, energy generation from fossils, accidental fires, and of course industry. In addition to this, Ghana is challenged by its geographic location, which exposes it to the harmattan that deteriorates the air quality further. Denmark is a front-runner in the fight for cleaner air. Since the 1970s, the Danish government has imposed strict regulations in order to ensure cleaner air. It required courage to be a first mover, as the economic cost that comes with this is never popular. But we are benefiting massively today from an improved air quality, which contributes to placing Copenhagen on the top in ratings over livable cities. I believe the Ghanaians would have the same courage to be frontrunners in West Africa when it comes to clean air. Denmark is working with Ghana on mitigating the sources of air pollution in many areas. Some examples include Denmark's recent donation of 280 million cedi to the World Bank's Clean Cooking Fund. This global program is benefiting Ghana as well. A key component is the adaptation of liquefied petroleum gas for cooking among Ghanaians' households, schools, and businesses. On a more long-term basis, we work towards reducing air pollution in Ghana through our cooperation under the Accelerated Partnership for Renewables in Africa, the so-called APRA. The objective of this partnership is to transform the energy systems from fossil fuel sources to renewable sources. Introducing renewable is a significant step towards reducing air pollution. In some of Ghana's biggest cities, a major source of air pollution is the open burning of waste. This is an illegal and extremely dangerous practice, especially because of all the plastic that's often part of the burning. This has a severe negative impact on public health and contributes to climate change and causes severe air pollution. I experienced these illegal and harmful practices even in the suburb where I live in Accra. I have found that it's very difficult to stop this practice. In this context, I would like to share the way we deal with household waste in Denmark. We've made it compulsory for people to have their garbage removed, and we finance it through our local taxes. We've also developed a system where waste can be turned into a resource, providing energy for homes and businesses while reducing harmful emissions. Imagine a future where Accra could power communities by transforming waste into clean energy and where we could breathe much cleaner air. I believe that's a very nice vision. The cost of air pollution isn't just environmental, it's economic too. It implies lost working days, rising healthcare costs, lower life expectancies, reduced productivity, and all of these factors have a negative impact on a nation's economy. So clean air is not just a moral imperative, it's a smart investment. Studies show that healthier environment lead to stronger, more productive communities. And then there are, of course, all the employment opportunities created. Real changes happens when people are part of the solution. Public awareness is key. In Denmark, we've seen the power of communities coming together, whether it's sorting waste, embracing clean technologies, or planting green spaces. Ghana's vibrant communities are well placed to drive similar change, but we need to raise their awareness first. Let's not see a transition to clean air as a burden, but let's try to see it as an opportunity. An opportunity for Ghana to lead in green innovation, to create jobs in emerging industries, and to build healthier, more resilient communities. The air we breathe is one of our valuable shared resources, and improving it is a shared responsibility. Thank you very much for your attention.
Thank you very much, Vibeke Pedersen. She is Deputy Ambassador of Denmark to Ghana. Please, let's do it for her one more time. Let me just let you know that this is our national dialogue on clean air and election 2024. There are some issues that we've always left on the back burner, issues that we think, oh, these are not so important. We don't really talk about them. We don't hold the feet of the political parties to the fire of accountability on them. This time, all of that is about to change, especially with the ravages to our environment that we have seen. And that is why today, if you're joining the conversation, if you just joined us, it's our national dialogue on clean air and election 2024, brought to you courtesy of the Clean Air Fund and Breathe Cities. We're live on Joy News. We're also live on Joy 99.7 FM and myjoyonline.com. So we're about to kickstart the main conversations, and we're going to now hear from the political parties. They are going to be sharing with us what their plans are, what their manifestos say, briefly. And then the conversation will proceed from there. So I am going to invite to deliver some statements, starting with the representative of the National Democratic Congress, joining this conversation, Professor Martin Oting Abebio. He is chair of the NDC's Manifesto Subcommittee on the Environment. Thank you, sir.
Thank you very much, and good morning. So, the NDC manifesto is very particular about air pollution. We see it as a silent killer because it is one of the infant academic discourse that we have witnessed over the years. Very little research is done academically. We don't talk about it on radio, but it impacts on us seriously. So what we intend to do with the NDC, should we gain power, is to tackle the issue of air pollution from the root. We've identified the root causes, and we witnessed some of them here. They talked about transportation, they talked about opium burning, little did they talk about other sources of pollution that impact on us, for example, how we manage sanitation. So I was surprised when our honorable member, the Deputy High Commissioner, talked about Danish contribution, failed to acknowledge that Danish government is sponsoring the strategic partnership, is sponsoring a project in Tema where we are looking at wastewater management as part of our bid to keep the system clean. So first, with transport, we intend to give priority to electric vehicles. The challenge that we have, most governments over the years, is how to zero rate the taxation on electric cars. We know these cars are old. The cars that we commute with are very old, and the emission is very great. We all know that we can reduce that impact by giving our transporters good cars. Today, if you bring in an electric car, the taxes that you are supposed to pay are beyond imagination. And that does not encourage people to bring in electric cars. And because mass transportation is the way out, we intend to make taxes on mass transportation vehicles as low as possible, as a way of mitigating the impact coming from transportation emission. If you want to go into details and look at the nitty-gritty of research that have been done about pollution, UNICEF and World Health Organization in 2018 did a research and concluded that 23 million of Ghanaians do not have proper sanitation. We do have a sanitation tax. And if I should read to you the amount of money that we have incurred, we've been able to collect over the 3 years, it's amazing. In 2021, a total amount of 421 million was collected from taxes. In 2022, we collected close to 457 million. In 2023, 452. As of October 2024, they are running 451 million. These should be able to help us. We know that 55% of Ghanaian hospitals do not have proper waste management system. And people go to hospital and go through this polluted environment. You are going for medical treatment, but you go and consume other polluted environment, and that becomes a challenge. We need to fix all these, and we intend to use monies accrued to fix the sanitation system and avoid some form of gaslighting that we subject our people to. If you recall, on 20th October, the Tema pumping station was commissioned by the government in 2020. Once it was commissioned, We are in 2024. The project has not been fixed. Now we still discharge liquid water into the sea, and I think that is something not good. We would want to fix it. Thank you very much.
Thank you very much, Prof. Let's do it for him one more time. So this is an all-encompassing conversation. It skipped my mind to mention when you were coming that you had only 3 minutes. And so it's not your doing. Blame me. For the rest of the speakers, I'll try to be fair since I did not hold him to 3 minutes, but try and moderate your thoughts so that we can get into other salient issues. Also joining the conversation, representing the movement for change, we have the spokesperson, Courage Nobi. Courage, the floor is yours.
Thank you very much. All protocol duly observed. Before you give me problems, I am the Deputy Director for Policy, not a spokesperson. Thank you. Clean air. The Honorable Alantra Martin believes that we need to drastically transform the Ghanaian society. To be able to do that, you need a healthy workforce. And that is why clean air is absolutely important to him. In his great transformational plan, he proposes that we tackle this problem 3 ways. The first one is local government. A lot of us, or we all live in local communities. But what is the level of enforcement of laws at this in our local communities? And to that end, he promises to review the constitution for the election of MMDCEs, such that each individual will feel or know that this local government official is responsible to him. So if he finds activities in the local area, whether by a factory or a neighbor, he can walk to the office and seek accountability. So that is one way. These elected officials will then be taxed by the local people on law enforcement. Because what we have is that the president who appoints these people, the people find themselves, or the officials find themselves responsive to the president and not the local community. Meanwhile, the president does not live in all the local communities that we have in this country. That is one. 2, he also believes that this is a matter of fixing 2 aspects of our development in urban communities: transportation. To that end, he believes that we need to continue to improve our ability to assemble cars here so that we can reduce dependence on imported used cars, most of which are responsible for the heavy emissions that we see. So he's going to expand that so that we can make new cars cheap here in our economy, as against the vans that we import and then put seats in them, crowd people in the engines that are very aged, that cause a lot of the emissions that we see. This will achieve the impact of creating jobs for our young people, particularly our engineers. Now, the empowered young people who are now employed can now, by social condition, begin to move, even their families in the villages and other places who depend on burning wood as a form of energy, to gas. So it's a whole connected ecosystem of solutions that Alantra Martin is looking at. The people who are burning wood as a form of energy for their domestic use, it is not because they don't have a better alternative. They cannot afford the alternative, which is a function of their economic standard. So a transformed Ghanaian society would automatically migrate people, because once people are transformed, they're educated, they're economically empowered, they seek better options and alternatives. To that end, a policy that ensures that we move away gradually towards clean energy solutions is also on the burner, such that even in local small production capacity businesses, we have them depend not on continuous burning of fossil fuel, but clean sources of energy like solar and other alternatives. This is the Alantra Martin and Movement for Change pledge. Thank you very much, and I wish us all fruitful engagements.
Thank you very much, Courage Nobi, and my apologies for murdering your portfolio earlier. Hopefully, you'll be forgiven, and so will I. Isn't it interesting, though, for those of you watching us, for those of you listening, for those of you here, how when election time arrives, political parties wax lyrical about many things. We sound very articulate, it's so refreshing listening to them, especially around this time. The devil is sometimes when they assume the reins of power, right? Then it appears everything they said is thrown out the window. You are muttering to yourselves, it not be true. It not be so. I know some they can't say it be so because of the offices they occupy and where they are sitting. But something must change. It's like that saying, you can't keep doing the same old things and expect different results. You keep doing the same old things, you get the same old results. Let's now hear from Kwame Nkrumah's own. I don't know whether it is still Kwame Nkrumah's own or whether there's been a transmogrification. But the CPP is also in the house. I see Issa smiling. Issa Abdul Salam is the CPP's Ashanti Regional Secretary. He'll be speaking for them on this platform. Please, let's welcome him.
Good morning. With CPP, we believe that each and every one is entitled to good air. Every Ghanaian must enjoy a quality air. And to ensure that, we have three approaches towards it. First, we want to reduce emissions from our vehicles. By doing that, it is under our government, we are trying to bring in a relief for those tractor drivers to be replaced with new cars on a higher purchase, so that all these cars who are 30 years and 40 years plus will be taken out on the motorways. We are also looking at encouraging usage of solar energy more than the normal electricity energy due to burning of fossil fuels as the demand for the electricity. We are also considering alternative for using some of the chemicals like the pesticides to minimize the agriculture side of pollution that we are experiencing. One of the things we observe as a government, as a political party, is that Ghanaians don't understand the reason why we talk much about air pollution. People don't even trace the cause of some of their respiratory disorders that they experience. The asthma they experience, the lung cancer they experience, they don't know. I think we need to have a time on our media to educate people the long-term effect of some of these air pollutions that we are creating to ourselves. And finally, under our government, we are trying to minimize the burning of waste, especially what is happening in Accra, as my brother narrated. People burn waste, burn plastic waste, purposely to make some small money. I think we need to enforce law to ensure that these things are stopped and ensure that we have a quality air. Thank you.
Let's do it for Issa. Thank you very much, Issa, for coming to speak on behalf of the CPP. We still await the arrival of the New Patriotic Party's representative. When he gets in, we shall offer him the opportunity of interacting with all of us, he or she. It is now time for us to take our keynote address on the matter. Clean air, election 2024. Where have we been? Where are we now? And based on some of what we've heard, where do we aspire to go? When you read our Constitution, it talks about the aspirations of the people and how governments must strive to help the people self-actualize, get there. In terms of clean air, what is the agenda? I'm pleased, ladies and gentlemen, to give you the CEO of the Environmental Protection Agency, who will be delivering our keynote address in the person of Dr. Kingsley Kurugu. Let's welcome him. Please, let's keep clapping. Let's keep clapping till he gets here.
Thank you very much. Good morning. I was not Apologies that I was not here right from the beginning, so I did not get to hear the protocols that were mentioned, so forgive me if you do not feel properly recognized. And thank you, Joy and partners, for the invitation to share some thoughts on this very important topic. And rightly so, when political parties are involved, one of them would likely take over the reins of government, and we are looking forward that whoever takes over will tackle the issue of clean air heads on. So, with all protocol observed, air is an essential element needed by the entire ecosystem of which we humans are part of it. However, air pollution has become a threat to public health and sound ecological balance in recent times, compromising the quality of air that we breathe. And there are two major sources of the air pollution. One is natural. Hamatan is around the corner already, sea salt, decaying vegetation. The other is anthropogenic, human-induced, which is increasingly becoming a major concern to all of us. The available statistics, I'm sure you've already heard some of these. 99% of the world's population live in places with unhealthy levels of particulate matter, with aerodynamic diameter of 2.5 micrometer, while 34% live in areas that exceed even the least stringent WHO interim air quality targets. And populations from low and middle income countries are exposed to 1.3 to 4 times higher levels of ambient particulate matter. And almost all of the global population breathe air that exceeds the WHO guidelines limits, with an estimated 2.6 billion people exposed to high levels of household air pollution from the use of traditional cook stoves and unclean fuels. More than 28,000 people in Ghana die from exposure to air pollution every year, according to WHO data. This number is projected to increase if no action is taken to tackle the issue. And according to the World Bank, the Bank Country Environmental Analysis for 2020, air pollution is Ghana's #1 environmental risk, responsible for about 8% of total annual mortality, which is disproportionately borne by infants and the elderly. The cost of air pollution in Ghana's 2 largest cities, that is Accra and Kumasi, is estimated at $264 million per year. And according to the State of Global Air report, which was just presented in Baku last week when I was there, exposure to air pollution is linked to 1 in 8 deaths worldwide. Indoor and outdoor air pollution are currently the most significant environmental contributors to premature death in Africa. Beyond these deaths, many more people are living with debilitating chronic diseases, putting tremendous strains on healthcare systems, economies, and societies. Much of the disease burden is borne by young children, older populations, in low and middle income countries. Air pollution has become the second leading risk factor for death, both in terms of total global population, as well as in children under 5 years. also air pollution, caused around 8.1 million premature deaths globally in 2021, and over 90% of the deaths are attributed to air pollution from ambient and household air pollution. Monitoring results from our agency, the EPA, from locations shows high levels of particulates above the national standard for most of the allocations that we are monitoring, particularly the major cities of Accra, Kumasi, Tamale, Takoradi. And to make matters worse, climate change has also been identified to impact on air quality by increasing dust generation from prolonged drought. At the same time, some air pollutants are known to exacerbate climate change. So we have a double-edged sword challenge. The impacts include that air pollution affects all of us. However, it has a disproportionate impact that's affecting sensitive populations, including pregnant women, babies, children, older people, the poor, and the historically marginalized. Although long-term exposures have been identified to contribute most to the burden of disease and mortality, short-term exposures from high air pollution episodes are also known to affect human health. And it also affects both plants and animals' health. We have a robust regulatory framework, although there is no specific policy for air pollution, and maybe the political parties may be interested in that. However, the 1992 Constitution, the National Environmental Policy 2012, Environmental Sanitation Policy 2010, the Transport Policy, Energy Policy, Climate Change Policy, Environmental Protection Agency Act, and in the new bill that Parliament is dancing around to pass, we have emphasized the need to deal with air quality. Unfortunately, we don't know when we will get our bill passed. The Hazardous and Electronic Waste Control and Management Act, and then the Ghana Revenue Authority Custom Division Law, the Ghana Road Transport Regulations, Ghana Standard for Environmental and Health Protection, Ghana Standards for Environmental and Health Protection, the requirements for motor vehicles emission, and other commitment to international obligations like the SDG. So we have a multiplicity of regulatory framework. The next crucial thing is how do we enforce these regulations? In terms of pollution sources, the identification of sources of pollution is very critical in devising interventions to control air pollution. And the identified sources include industrial emissions, emissions from vehicular and other fuel burning installations like generator sets, poor road networks, and activities of the built environment such as open burning of all manner of materials, including electronic waste due to poor waste management practices, the use of biomass and charcoal in cooking, wind-blown dust from bare ground, among other things. And as the Harmattan set in, wind-blown dust is going to be very common. Air quality monitoring is an important area. An air quality monitoring network was established in Accra since 2005. And monitoring is conducted to collect data for decision making. Besides the Accra monitoring network, a number of low-cost sensors has also been installed in 4 other cities, including Takoradi, Kumasi, Tema, and Tamale across the country to provide an indication of the state of the quality of air in these locations. Development of standards, regulations, and guidelines. In collaboration with the Ghana Standards Authority and other stakeholders, the Ghana Standards for Environment and Health Protection, requirements for ambient air quality and point source stack emissions 2019 was developed, and the Ghana Standards for Environment and Health Protection requirements for motor vehicles emission 2018 is also now in place. These standards define the maximum permissible levels as well as the standard methods for measurement of the required parameters for industrial and ambient emissions and vehicular emissions, respectively. Regulations have been developed awaiting passage into law to, among others, enforce the standards and promote air quality management. Now, these regulations are contingent on the new act. So they're not passing the EPA bill has also put all these regulations on hold. And a number of guidelines has been developed to promote sustainability in the industrial and waste management sector. These include the technical guidelines for sound management of used lead-acid batteries. The guidelines will facilitate the application of best practices in the entire value chain of used lead-acid batteries management. And then also the vehicular emission control. To collaborate, we collaborate with DVLA to enforce standards. Vehicular testing centers has already been established. Industrial emission control, as part of the environmental assessment process, undertakings are required to install pollution control systems to ensure emissions levels are within the permissible limits. This is an area that we battle with undertaking because it's a requirement, and we are not yet, as a society, sensitized enough to appreciate why that requirement comes with a schedule when we are permitting. They are also required to monitor air emissions from point sources and air quality at the fence line at defined frequencies and report to the EPA. The Ghana Cleaner Production Center was also established to promote resource use efficiency and cleaner production. This center is in Tema. And so it's also a place that many people who want to set up factories can go and get advice on cleaner production. And then the hazardous waste management system, enforcement of the provisions in the Hazardous and Electronic Waste Control Management Act 2016 and the Hazardous Electronic and Other Waste Classification Control and Management Regulation 2016. It's also a very important aspect for any of you who takes over government to make sure those regulations are enforced. Air Quality Management Plan has also been developed for the Greater Accra region to collaborate with all stakeholders to reduce pollution to acceptable level. What are the key challenges? And this may be more interesting to the political parties. Inadequate monitoring across the nation. Air quality monitoring is centered largely in Accra and some few cities as I have mentioned. And so we aspire to be able to have sensors all over the country to be able to monitor. Installation of sensors by individuals without recourse to EPA, leading to duplications of efforts. Sometimes during the monitoring, our monitoring teams would discover that some NGOs, other actors have installed air monitoring sensors without recourse to the EPA. And that is unfortunate. So we do appeal to the public that if you want to install these sensors, come to EPA so that we can capture it as part of the system in place and be able to report accurately. Then, of course, high cost of equipment and import duties, that if you want to import these sensors, you have to pay high costs. Inadequate implementation of the available policies, legal and regulatory frameworks, which is what I already made the appeal. The lack of regulations to enforce the air quality and vehicular emission standards. These standards are in place, but we need regulations. And because EPA has been working on a new bill, we need the new bill into law, and then we can take these regulations through Parliament and be able to enforce on them. Continuous use of age-based taxation system. The penalty on costs, insurance, and freight on overage vehicles also need to be looked. What can we do quickly? By all of our stakeholders, it is possible to reverse the trend by taking measures to address the drivers of air pollution. Over the years, policies and improved technologies introduced among countries have yielded some results, proving that pollution is not an inevitable byproduct of economic development. The State of Global Air report reveals that since 2000, death rate linked to children under 5 has dropped by 53%, due largely to efforts aimed at expanding access to clean energy for cooking and awareness creation, among others. So collaborate with the EPA to do monitoring. Let us all together promote stronger advocacy and awareness creation to stimulate attitudinal changes among the populace to promote cleaner air, promote the use of clean energy fuels, and improve cook stove. There are now quite a number in place. Enforcement of laws and regulations on the various sectors that energize air pollution and degrade air quality. Let us promote best practices like circular economy and cleaner technologies in all sectors of the Ghanaian economy, but with emphasis on waste management, transport and industrial sectors. Let's promote sustainability in the transport sectors, and finally, effective collaboration and partnership with all stakeholders across the sectors is important if we are going to have clean air to breathe. I thank you for your attention.
Thank you so much, Dr. Krugu. And I would ask that you stay with me a bit longer. He's looking at me quizzically, wondering what I'm up to. No, I mean that. I would like you to stay with me briefly so that I can get some very good air, clean air. But not only for that, because I would like him to be joined by Desmond Appiah. Desmond, please join us here. Let's put our hands together for him. Country Director, Clean Air Fund, because we are going to launch the Clean Air brochure. Ladies and gentlemen, I know a lot of you have your copies. All of you have copies. Let me see by hand. Great. And so I'm going to leave it to you, gentlemen. And at the point where they declare it duly launched, I want all of us to show solidarity by raising our brochures. Over to you, gentlemen. I would like a few words from each one of you, and then you can go ahead and launch.
Thank you very much. A Clean Air Fund with a lot of support from EPA, and ED did not mention that, but there's been a lot of conversations that we'll be having with EPA, and we appreciate the support and the collaboration. We worked with a number of experts whose names are at the back of this brochure. We made it very handy. You could actually go through this in less than 30 minutes, and it will give you good enough information on the statistics, most of which have been mentioned here, and the declaration by the UN that clean air is a basic human right. I mentioned earlier that we haven't been making demand for clean air. Hopefully now that we have this handbook, we'll be able to familiarize ourselves with some of the issues and the call on the political parties as to why this makes good sense. We are aware, and ED mentioned, about resources. We are aware also that there are resources. The World Bank is represented here. Danida is here. And we are aware there are resources if we target it. Edie, it is clear that most of the time when our politicians go and engage, they are not asking for the specific things that help to improve our air quality. We are asking to build a road. What we are saying is that let's build a road with clear lanes for non-motorized transport, with opportunity for light rails, with opportunity for people to be able to walk. As we promote these interventions, we are sure it will help us. Edie, do you want to add a few before?
Thank you very much indeed. Clean Air Fund, they're doing a fantastic job, and we work very closely. And that was my appeal to all others who want to work in the sector to come to the EPA, and let's have a close collaboration, because when it comes to air pollution, there is nothing like I am living in East Legon, and so I'm in a certain serene environment, and I don't care what is going on in Agogoloshi. This is air. It will travel to wherever you are, and whatever it is carrying with, it will bring it to you, and you will inhale it. So when it comes to clean air, it's everybody's responsibilities. And indeed, you are right. This is a basic human right now, and we need to demand it also from duty bearers, that we all need to have clean air. And let us all join that advocacy. And I do hope that the political parties, if this is not well emphasized on your manifesto, as soon as you are sworn in January, convene a national stakeholder conversation on clean air and begin to put in place a clear policy on how we can have clean air to breathe. So that is my little contribution to that. And with those words, we have the honor and the privilege. Can you all reach out for your copy? And as you lift it up, is an indication that you are going to advocate for clean air in Ghana and across the world. And with that, together with my colleague from Clean Air Fund, we duly declare this brochure launch. Thank you very much.
Thank you so much, Dr. Kingsley Kurugu. He is the Executive Director, Environmental Protection Agency. We also had the Country Director of the Clean Air Fund, Desmond Appiah. Thank you so much, gentlemen, for having done us the honor. We're still live on Joy News, Joy 99.7 FM, myjoyonline.com. It has to do with this national dialogue on clean air and election 2024. It's your human right. It's a human right, basic. So let's push for it and ensure that the right things are done. Shortly, we shall get into that panel discussion where we have our technocrats who are going to be joining the conversation, breaking down the salient issues for us. And that's where we'll bring in some of those basic issues that we all see around us and contribute to the issues. We might as well go right into it. And so I'm going to introduce the guests for you shortly, those who are joining us from academia, among others, to deliberate on these issues. It is my pleasure, first off, to welcome aboard. They say ladies first, right? So she knows I'm coming. Dr. Sandra Kwarteng-Owusu is a senior lecturer with the Department of Child Health at the School of Medical Sciences at the Kwame Nkrumah University of Science and Technology. Please do us the honors, and you will sit right there. Following her, we have Professor Kofi Amega, Vice Dean of the School of Public Health at the University of Cape Coast. Please use this route. Thank you, please. First one there. Also joining the conversation, we have, of course, the Clean Air Fund, Breathe Cities. He is the portfolio manager in the person of Dr. Elvis Tre Jabo, please join the conversation as well. Now, over the next 30 plus minutes, we're going to be conversing about myriad issues in respect of clean air and where we hope to go. Let me just also inform you that there's going to be an open forum, a question and answer session. We'll pick social media comments. And I would, when we are done with this, please observe keenly. We would like to hear from you as well. You are one of the Doyen's environmental protectors, if you like. Those of you who don't know her. I remember the last time I met her, she was in front of Parliament with a placard. I mean, she behaves as age hasn't caught up on her, and she does a good job. So I'll hope to hear from you after the technocrats engage with us. But as we kickstart the conversation, I think please come closer to me and we can let go of this microphone so that we can occupy the space that is close by. I would like to pick your initial thoughts, and I'll start with you again, Doc. Ladies first, and then betatao. In respect of the discussions we've had so far, what the political actors have signaled they are likely to do, where we find ourselves now, and where we aspire to be. I just want you to situate briefly from that angle, and then we'll get into other details. Doc, starting with you.
Good morning. Thank you for having me. I want to say thank you to Desmond and his team from Clean Air. You've been working very hard since we met in 2019, and all the other panelists. Yes, so for me, I think it's reassuring that we even have this meeting today. What has been happening over the past is that there are different people who are very passionate about clean air, but we've been working in isolation. So this very move of having everybody under one umbrella discussing a common issue with the political parties represented, knowing where we are heading towards, is very reassuring. We all are at least getting close to the sense of being very committed to the air we breathe. And you said, where have we come from? From my background as a respiratory physician, I think increasingly we've been worried about the rising levels of respiratory conditions. I see children with asthma, and we've just released a paper in the Lancet Adolescent Health, a multi-center study, which is showing that for adolescents 12 to 14 years, 16% of them that we screened in Kumasi actually reported asthma symptoms. That's massive, because in the last 20 years, we were around 5%. So if we've climbed up to 16%, that is concerning. And we know that children are very vulnerable. We are also raising the awareness that if you look in the line of the very young ones, so the CEO of EPA mentioned that children less than 5, extremely vulnerable, extremely vulnerable. In fact, prematurity is also on the rise. And I know there are reports from the UK that is showing that low birth weight and preterm births highly related to significant levels of air pollution. Our past, most of us have come in from small towns where solid fuels have been used for cooking. Remember how our mothers will carry us on their backs, and your nose is pointing right into the smoke every morning. What makes air pollution an issue is that it's a cumulative thing. So you are born, and every morning your mom is carrying you, and she's busy making the firewood, lighting, and you are exposed to significant amounts of smoke. So the picture I want us to imagine, do you remember that every morning our mothers would mix clay and apply it to the wall? Who remembers? If you leave it for a week, what do you see? It's all very black. And this is what happens inside our lungs. And so if you are exposed over and over for about 6 years, 10 years, then we have seen what is happening. So the background of Africa and Ghana is high burden of infectious diseases, which was 2 decades ago. But now, significantly, we are seeing very high levels of non-communicable diseases, specifically respiratory conditions. So that is where we are. So it is very reassuring that we're getting some commitment from political parties. We're getting commitments from EPA. We're getting commitments from academia. We're getting commitments from civil society organizations, as in working together for a common goal, to get all of us to breathe clean air. That is very reassuring. So I think that's where we've come to.
Thank you very much. And as you spoke about, the exposure to smoke and all of that, I was just thinking, for those who smoke in addition, so if you're exposed to all these, pollutants and you add smoking to that, I don't know. But these are things that we all go through. Prof, what would be your initial takeaways from the reactions you've heard so far?
My initial reactions is just to commend Clean Air Fund, Mr. Desmond Appiah and his people for putting this together. You know what, the fact that we are having this conversation around this time is even reassuring. It makes the political parties and the Ghanaian populace aware that we have a ticking time bomb. Air pollution is a very critical public health problem and needs solutions. And in his initial submissions, Mr. Appiah talked about political will. And the political will is very critical to addressing air quality in the Ghana landscape. So I think this discourse is very good. We have the actors, they have provided pointers as to how they are going to address the issue of air pollution when they take political power. I'm just hoping and praying that it's not the usual rhetoric, and that they will capture power and indeed assist the EPA, assist academia and other stakeholders to help address the problem of air pollution on our landscape. So that's my initial reaction. Thank you.
Thank you very much. Doc, over to you.
Thank you very much. Thank you very much. And thank you everyone for being here. The interesting thing I would want to draw everyone's attention to is we tend to talk about the cost of air pollution, and most of the numbers we refer to is from 2016, 2017. What it means is that in 2017, the World Bank said the cost of air pollution to Ghana was $2.5 billion, which is the cost people incur when they go to hospitals, when you don't go to work, when you have to spend on your child. Fast forward to now, 2024, what it means is that we are probably around 4 billion or even more than that. And that is how much it's costing us when we do not do anything about the air that we are breathing in, day out. It means that we're going to spend more money on taking care of our kids, more money on our pregnancy health care, more money on things that would not have initially costed us money. When we talk of saving from addressing air pollution, most people think there's money that we would get, but it's saving in terms of money that we did not use because we addressed air pollution. And the more we think of it, that most of the numbers in all the research are almost 5 years old. It means that it's costing us even more when we think about it. The numbers may have doubled in some instances. And it's important for us to not only think of it that it's only for us to address the issues, it's also for us to protect our health. Even if you work in an air-conditioned environment and live in an air-conditioned environment, do your kids attend an air-conditioned school? Are the playgrounds air-conditioned? Are all your family members living in a protected environment? You can't afford that for all your dependents. So in one way or the other, you will still bear the cost. Whether you know it or not, it will come to you in one form or another. So it's important that we see it as a huge economic drain and find the most effective way to address it. Thank you.
You know, you piqued my interest when you spoke about $4 billion. Can you imagine why?
The main reason is that at the time where this analysis was done by the World Bank in 2017, they looked at the cost of healthcare cost to the National Health Insurance Scheme, to what people spend, to what people do not make because they don't go to work. The more time you don't go to work, it means you're not making that money. And over time, the last review we did with some of the districts, air pollution-related infections is in the top 3 for all the districts that are part of Breathe Accra. And what it means is that people are now going to the hospital more than going to the offices. People are now spending more time away from economic-making activities. So in the end, you end up not making money, but spending money you are not making, because you need to address the things that are affecting you.
And like I was saying, it's not a subject that anyone wants us to discuss, but it's our reality. Open defecation, for example. The statistics reveal that if we spent about $76 million providing about 1 million latrines, okay, would save so many more millions in the country. Doesn't make any sense then that we don't do that. You see, those are the challenges. And when you mentioned the 4 billion, approximately, right, that's even more than we're getting from the IMF. But anyway, the point to be made is something must be done. So let me come back to you, Doc. What then can be done from the educational and policy standpoint? Because obviously we have some of the policies. Dr. Krugu spoke to us about them. But the beautiful thing about Ghana is we have beautiful policies that are simply not implemented. So how do we educate and how do we enforce? How do we get to that level where we are actually protecting air quality?
Okay, so air pollution and addressing issues of air pollution, it's everyone's issue. We can all do something. So we are here, we are interested in air pollution, we are getting educated. That is good. So if we all go back to our homes, our churches, our mosques, and ask the leaders to give us 5 minutes to talk to everyone in the church, in the mosque, about our health in terms of clean air, that is one step. We can do something. We've gone round, so issues about equity and access. For some people, it's their livelihood. So last week in Kumasi, we had an open forum discussion. And I was telling Mr. Apia about some women who depend on using solid fuels to cook, and that is their livelihood. Maybe we can reach out to them. It can be government, it can be any other policymaker, any NGO. This is a life and death matter. Over time, some of these women are at risk of developing chronic obstructive airway disease. That is where, when you are 50 years, you've never smoked cigarette, but you can't walk any distance in a hurry. Your lungs and eventually your heart would begin, in a sense, to not work effectively. So we can educate those women to protect themselves. What they can do from today is to at least put on a protective mask when they are by the solid fuels. When they are lighting the fire, when they are making the firewood, they need to protect themselves. So education comes in here. In our homes, we can avoid burning our waste. In fact, we all want to begin to separate our waste. Don't add the bottles to everything, the organic waste. Let's, in our own small way, separate it. We can do that without any government coming to our homes. We've educated, so the schools that were involved in our asthma studies. What was also interesting is that when we gave air pollution monitors to the children and we monitored their sources of pollution, for the school that had the highest number of adolescents with asthma, they also had very high levels of pollution, so we could relate. So what we saw is that some of the public schools, for instance, do open burning. When the school children are on the compound, we educated the teachers that if they can liaise with the local authorities, because you would see that in a community, the whole refuse dump is just next door to the school. Can they avoid burning when the children are on the compound? Maybe they can start on Friday. So that is what we can do. But the others is for us to enforce the policy. So let's make more noise. Let's reach out to our leaders. Let's talk more. Let's discuss it more. Joy FM continue to dedicate time to discussing issues of air pollution. That is how we can help it, because we're seeing so many children with respiratory conditions, as Dr. Jabo said. Top 3 causes of death, we see that respiratory conditions, cardiovascular conditions keep appearing, and that may be related to the cumulative effect of air pollution.
Right, thank you very much for those comments. Let me come to you, Prof. So following from there, let's talk about transportation and waste. But even before we get there, you'd realize that the charcoal she speaks about, some people, when they are trying to set the charcoal ablaze, will use plastic material, whether polystyrene or whatever, to burn first. And that makes the exposure to the smoke even worse. But you're a doyen of public health. When it comes to transportation, I remember some years back there was some talk about restricting importation of vehicles of a certain age into the country. I guess that fell through. There's also the bit about waste. Interestingly, a lot of the hand-me-downs, I'm talking of Obroniwewu and others, are coming to the country. Some of them end up on the seashores, and others, it's good we have the Danes here joining the conversation. But some too are burnt, so also contributing to the waste in the system and lower air quality. How can we tackle these?
Before I respond to that question, let me add a little bit to what my sister and colleague, academic, said. You know what? You can't address something you cannot measure. So I think the key point is that we need to have access to air quality data. And in his submission, the CEO of EPA alluded to that fact. So because data drive decisions, so there has to be huge investment in making sure that we have air quality data and also the sources of these data. So then, when there are some source apportionment studies, they will be able to know that this is the level of pollution that is emanating from transport, is emanating from domestic cooking fuels, etc. But the solutions are simple. By way of transport, you have indicated that there is a law, a policy on banning vehicles that when you bring in is 5 years, 10 years old. But are we enforcing this? The problem that we have in the country is enforcement. We have a lot of laws on our status books. You go to local governments, the district assemblies, they have a lot of laws, directly and indirectly, bylaws that addresses air pollution. But the enforcement is the problem. So, and not too long, we also hear that you bring in the vehicle, and even if it's over age, you can pay some penalties and bring it out. Why do you have to pay penalties and bring it out? Because these are vehicles that have poor emission ratings. So we shouldn't tolerate them in the country in the first place. But behind this is that we have to address the endemic poverty issues. How many of us in this room can afford a brand new vehicle? So that is the reason why it was refreshing to hear from one of the parties that they're going to invest in assembling of vehicles in the country. But to what cost? Is it going to be something that we can afford, such that we're going to be able to buy brand new vehicles that are assembled locally and not rely on importation of vehicles from abroad, Europe and North America?
But even then, just to interject briefly, it is a good project. It lowers the cost, but by what margin?
Absolutely.
Is what people ask. Is it affordable?
Yeah.
Still, even at that level, is it affordable?
Yeah, is it affordable? And what are the schemes for getting this? Because in Europe and North America, there's high purchase. So you don't necessarily have to do a huge savings to go and buy this vehicle. The bank buys and then you pay on high purchase, etc. But one of the key things that could address emissions from the transportation sector was the emission tax that was introduced. I don't know whether it's still existent. But for me, I wasn't sure whether it was another stream of income for the government or it was going to be used to tackle emission. Because, listen, if I'm driving a brand new vehicle, why do I have to pay the same emission tax as somebody who is riding a trotro or a 1998 vehicle? So you tax those people heavily. And then that serves as a deterrent from bringing in those overused vehicles. And the other thing that we didn't even look at that emission tax is that we should link it to climate change, because when you address these emissions, there are also short-lived climate pollutants like black carbon, which we are also addressing. So these are things that we can do to address the transportation sector pollutant. But also, finally, what Mr. Appiah also said, investment in non-motorized transportation. We are always developing our roads, but we are not making allowance for bicycle lanes. We are not making allowance for walking. And if you do that, then of course, people are going to walk and cycle to work. But not only are we addressing air pollution, but also our cardiovascular health gets improved because you increase your physical activity levels. So these are simple things that we can do, but it appears very difficult for us as a country.
Thank you very much. I'm going to take the final bit from you. Before I do that, let me let the audience know, though, we're going to come to you shortly. We have just about a quarter of an hour to wrap this dialogue. I'll come to you as well for you to pose questions you have, share any contributions you have. If on social media there are any reactions there, we shall take them as well. I will be coming to you first to kickstart it, so sometimes it's dangerous for me to know you in a setting like this. But I'll come to you, Doc. So 2 things I want you to quickly address. Resource allocation towards dealing with the problem at hand. And I also want you to look at how relevant it is, electric vehicle technology, and where perhaps we should be headed, briefly, so that we can come in with Q&A.
Thank you. So to mention on resources, I would start from the global perspective. I think there was a global pact that there were going to be a fund that would address air pollution in low-income and middle-income countries. Unfortunately, that pact didn't meet its expectation. The last research that was done with the support of Clean Air Fund, which is the state of global air quality funding, found that 1% of funding goes to air pollution globally. And out of that, if you consider countries in Africa in 2022 got 1/3 of all the funding that goes to a single country in Asia. So Philippines got $4.5 billion for air quality funding. The whole of Africa in 2022 got $1.5 billion. What it means is that there is uneven resource allocation for addressing air quality globally. When we come locally to our economic planning, we also, as Prof mentioned in his state, there are taxes that go to the environment or sanitation, but there's not allocation of that resource to address air pollution, waste burning. To say that we're going to do this to do waste burning campaign to stop people from burning it, because it's the waste that they are burning. And so we need to rethink of how we are allocating resources to address air pollution globally and then internally as a country.
And I was about to get to that, Dr. Jabo. There are times where I feel a bit sad because we're always talking about externally what can come in. How about internally? I mean, you are facing the consequences. You are experiencing 28,000 people dying from these peripheral issues. What can we do locally? Can we not allocate more resources towards this?
That's something this dialogue is supposed to help us do. That we draw attention to it, that people are dying by the day, by the minute from air pollution. Our children, our pregnant women, there are more cases of miscarriage. And it's not just due to people's health. It's due to the polluted air they are breathing in. And so if we then begin to connect that my child is missing school because the air is polluted, my wife is losing the baby because the air is polluted, we'll now begin to realize that maybe the money we could have spent on other things can't be spent on cleaning our air so that we can make some of the savings we're supposed to. Thinking of electric vehicles, we had a project supported by UNEP nationally to look at electric vehicles. That project progressed nicely, which has led to introduction of some electric vehicles. It's also important that we do not miss the basics. If we encourage people to purchase electric vehicles without the adequate infrastructure of charging stations, it's not addressing the problem. What it will mean is that we're then going to use fossil fuel, burn it more to charge electric cars, which then negates the economic or environmental benefits which electric vehicles are supposed to bring. And so it's important that we think of what infrastructure are we going to use to power these electric vehicles. There are countries like Germany that only have 6 months of sunshine in some cities. Cologne is solely solar powered. It only has 6 months of sunshine. We have 12 months of sunshine and we still depend solely on fossil fuel. We need to rethink some of the basics to address the environmental challenges and economic challenges, which is affecting our health ultimately.
Thank you, panel members, for those very interesting submissions. A lot of food for thought. Please, let's put our hands together for them. It's now down to the wire. We're coming to you. And you see, wherever you stand, whichever political party you choose to support and all of that, like we've said here, you don't breathe Movement for Change air, CPP air, NDC air, NPP air. The air is the same thing across the board. So whatever they do, whatever they decide, affects all of us. And the diseases don't discriminate. So let's look at this carefully. I would like to invite some of you to ask questions. They have to be very brief. You mention your name. If you are with an outfit or you're a student, you mention quickly, straight to the point. Winding question, I'm sorry, I'll have to cut you off. I'll start with, okay, I said I would start with Awula Sewa, but let's...
All right.
Go ahead.
Good morning. My name is Collins. I think my question goes to the pediatric physician, right? Yeah. So in most of our schools, or in our culture, actually, we see sweeping. Sweeping is our tradition, right? And if a lady doesn't sweep, or if you don't sweep, you go to an environment and you don't sweep, we see it as an issue. Most of our schools, our children, when they come to class, first thing they do is they sweep. And they stir up the air, the dust, right? They directly breathe dust. To what extent is that killing us or affecting us? Thank you very much.
Thank you. Very interesting dynamic to bring into the conversation.
Thank you very much. Mine isn't so much a question as an observation. I think the point has been made that it's about enforcement, enforcement, enforcement. We don't really need external partners. We just need a bit of common sense. For example, separating our rubbish. It doesn't take external funders for us to separate our rubbish. Plastics go into one place, organic waste goes into one place, and so on and so forth. We put everything together. And then our local authorities, and the EPA, I have to say, we know what is going on. People are burning rubbish. Even when residents report, what happens? Nothing happens. So the same thing keeps on going on. Sometimes from the morning, if it's not pollution, you are breathing in polluted air, the water you go to drink is suspect. We face an existential threat, and those who are supposed to be enforcing seem to be allergic to enforcement. So for me, the primary thing here is enforcement, enforcement, enforcement. If we start enforcing, it's not a big problem. It's not a big problem. It's just the political will to do what needs to be done. Thank you.
Thank you very much. The simple point she's making, enforcers are allergic to enforcement. Where does that leave us? Only God knows. Any other submissions? We're taking one round, so we're taking all of these together. If there are reactions from our panel members, we shall take them and draw the curtains on the event. Carriage?
Thank you. I think mine will go to the EPA. We are celebrating that an interchange has been constructed that connects East Legon to Spintex. It's taken 8 years. 8 years of excavators digging, dust in the air, and all of that. A project that could have taken 2.5 years. All right. How is the EPA making sure that contractors are enforcing the regulations in terms of protecting us? That is one aspect. Two, I passed through Adenta, and it's a very, very well-planned community. Yet, apart from the main stretch of roads, almost all the inner roads are dusty. What is the EPA's solution to ensuring that local authorities, at least at the minimum, organize the people to contribute themselves to put pavement blocks? Thank you.
Thank you very much. And you took the wind out of my sail on the first question, because I was about to say it. You have a project that can be completed in 6 months, 1 year, 2 years. It goes on for 5 years. A lot more pollutants in the environment for people to breathe. So maybe you've not been finished yet. You've not got something, so we must give you something. So you go to hospital. How else would I put it? How else? Any other submissions? Yes. Let's take as many as possible very quickly. We have to go very quickly. Yes, sir.
Okay. Dr. Faisal Tikmo Abdallah with People's Dialogue. So I want to ask, how are we incentivizing with waste segregation and disposal? Because if you go to the communities, there are challenges with the cost of disposing waste. So they don't even see the essence of segregating the waste, because eventually it goes the same way and they dispose of it the same way. how are we trying to incorporate recycling in our waste management so that at least we can use that to incentivize them to segregate the waste and also dispose it effectively. Also, we are undertaking a study at Tema Newtown, and you realize that the fisher folks, they are burning, when they are doing their fishmongering, they use the solid fuels to burn, just kind of smoke the fish. And you talk to them about it, and their question is, that's what they've been doing all their lives, and that's what is sustaining their livelihood. What alternative do you have for them in order to adequately smoke their fish? Thank you.
Thank you very much for those thoughts. In other jurisdictions, if you segregate, you get something little for segregating, right?
Okay.
I'll come to you, but please let me take some of the, yes.
Yes, I'm Timothy. I want to find out from EPA. We know charcoal burning is one of the main pollutants in some of our areas, especially in the northern part. From the burning, the cutting down of trees to its burning, and to the household where they have to also burn, how are they working on that? Because I think even the government decided to bring cylinders to help support local, but we see that gas prices keeps on going high. So how are they working on that so that at least we'll stop this charcoal burning?
Thank you. Thank you for your thoughts. Next, I saw someone else. The gentleman in blue. Okay, so let's finish with that and Prof.
Yeah, thank you very much. Perhaps mine is in reaction to the gentleman who talks about waste segregation. The challenge has been with our waste policy. It's so much focused on public health without seeing waste as a resource. That's perhaps why in the NDC manifesto, we've made a point that we will review the waste policy to call for an integrated waste management where we will see waste as a resource. So that today, even if you do segregation on your own, when the service providers come and they are they combine them and take it away. Because we have not made avenue for people to do that, we hope to change the narrative, provide avenue by constructing buyback centers for people to manage their waste properly. Thank you very much.
Thank you. We know that there's no waste that is actually waste. Not even our human, you know what I mean. Even that can be used. Yes, there's a gentleman here, please, quickly. Let's get to him. And then I believe after this, I don't think we've had enough gender balance. The ladies are not talking. And I know there are some students here. I'll pick one or two in addition. Yes.
Yeah, thank you very much. And then excellent contribution from our panelists. My name is Richard Sechere from Urban Better Citizens. We are for clean air. My question is, I can see what you are doing here, it comprises of an initiative, and then we all the EPA, the Ministry of Roads, and others supposed to work intercontinentally. I want to ask, if they are going to construct the road, do they, consult the EPA, what they're supposed to do, or the road contractors, they just go and just make anyway, and then they go? Most of the times, as Prof said, when they do the construction, there are no, pedestrians crossing. The road construction, they don't bring any bicycle lane for us to walk. They just do it and do it straight forward, they go. So do they consult the EPA, or they just go and do their own thing?
Thank you. Thank you for the question. I'd like to take two more final questions, but from ladies. I'm going to be gender biased. Ladies, I see a number of you here who haven't spoken. Yes, you're looking at me smiling. I see you. Are you students? And students don't want to talk. You don't want to ask questions. Yes.
Okay, so my name is Stephanie from UPSA, a communication student. So I would agree with what Mami said, enforcement, but what I would like to add up is that we Ghanaians are intentional when it comes to waste. So we should be intentional about keeping and making everything neat. When it comes to the raining season, that is when the hormones of filth come up. You see the gutters being choked and the rubbish out there. These are the things that breeds a lot of sicknesses and respiratory disease for us. But when we are intentional about health and then air, we actually have a clean environment in Ghana. Thank you.
Brilliant point. Brilliant point. Thank you so much. Any other? Any other?
Excuse me, can I add something very quickly? When we're talking about segregating rubbish, we have organizations like CESA Recycling. In fact, eco-conscious citizens, we have 2 receptacles for plastics. So the community can come there and put their plastics there. Then CESA Recycling comes to collect them. But even then, you find the compounds, the streets still littered with plastics, even though the community in Adenta and also in Ladade Kotopom are aware that they are receptacles. But so I'll say that it's not the case that it will all be put together. If you separate your plastics, and then every so often you come and put it in the receptacle, CESA Recycling comes to collect them and it's recycled. Thank you.
Thank you very much for making that point. So let's all start doing it and it will catch on. Sometimes it takes one person. We'll be concluding this conversation shortly on Joy News and we'll just continue briefly after that. But for those of you watching us live on Joy News, we'll be concluding the conversation shortly. I need one more lady. Any? I saw this gentleman's hand up. I'll take you. If I get one more lady, fine. If not, we'll come to the panel, take our responses, including from Dr. Krugu, and then call it a day.
Okay, thank you very much for this opportunity. My name is Kofi Mawedem Noel from the University of Professional Studies, Accra. So my question is, how are we going to balance economic growth with environmental sustainability, particularly in the context of air pollution? That's my question.
Interesting question. Straight to the point. Any lady going 1, 2? I guess it's gone. All right, let me start with Dr. Krugu for responses. Please, let's get the microphone to Dr. Krugu for his response. There were some questions targeted at him, I believe, for him to get some answers. That's Dr. Krugu right there. Let's get the microphone to him.
Thank you very much. And I would contribute to ensuring gender balance by leaving the charcoal burning to my colleague from EPA to comment on. But road constructions, I think there are 2 or 3 questions that refer to that. I mean, first of all, to make it very clear, you cannot construct a road without obtaining permit from the EPA. So that should be clarified. But as a people, I think that you cannot have a policeman to get everybody to do the right thing. And that is what I call for attitudinal change. All of us have to have that responsibility to be able to keep the air clean. When we permit and our monitors go and we try to enforce the environmental and social responsibilities that comes in the construction phase, then you get into all kinds of criticism. And sometimes you are seen to even be the one who's trying to delay the work. If you insist that certain measures ought to be put in place, or if you insist that certain time limits has to be followed. And
are the politicians part of the problem?
It's a collective responsibility.
No, you're not answering
all
me.
Of us.
Are the politicians part of the problem?
Yes, politicians are part. And all of us are in it. And sometimes I give you an example. This year we've had a lot of challenges that when it comes to road construction. And when we begin to insist, then people say we must finish in order to commission it to score political points. And so while you are trying to make sure that the regulations are followed and insist especially on social risk management, normally when it is funded by the World Bank and other things where the dedicated funding is easy. When it is GOG funding, it's quite challenging. My colleague will comment on charcoal burning.
Okay, so when it's GOG funded, it's pretty challenging. We all know of that. The little point I'll make in addition is, while I agree with you, commissioning any government's tenure, it extends to the 6th, getting into the 7th of January. But when it takes you 8 years, then sometimes, you run into some of these challenges. Yes.
Okay, thank you very much. When it comes to the charcoal burning, we all agree that the process of burning the charcoal also contributes to air pollution. But this is something we have been doing, and that is, like it's been discussed, what people are living on. But there are sustainable ways of doing it, where the pollution that comes from it is reduced. And we have tried promoting some of these sustainable technologies for those that come to EPA to take permits. But you agree that for the charcoal production, most of these are produced in the hinterland, where nobody even knows where they are. And that is where it becomes difficult for one to identify and even make suggestions as to what has to be done. So like we are discussing here, I think it is the responsibility of all, if we know where it is being done and we can help in creating awareness, I think we should do that because, like we said, it affects all of us.
Madam, quick point. What is the EPA doing to identify these spots? Because, I mean, it can't be so hidden that we can't find them and communities can't. What is the EPA doing in that regard?
Well, those kind of activities doesn't directly fall under EPA. And there are a number of stakeholders that must come together if we really want to address this. So maybe we should look at that collective approach to identify and intentionally identify them and deal with the issue.
Thank you very much. Thank you. Let me come to our 3 panelists, and that's how we'll conclude after you're done. Doc, I'll start with you. Any reactions to what has been said? So, Dr. Usu, starting with you.
All right. So, the question about sweepings. So, we don't always need to physically use a broom. Sometimes it is not so dirty, and the leaders or the teachers can supervise the picking. But we try to encourage caregivers of children with specific problems to inform the school teachers so that they are exempted from some of these activities that would, in a sense, harm them. We also educate the children to know when to wear face masks. I mean, that would be a moment where face mask will come in handy. We have highlighted that most of the public schools were the ones that had no paved floors. So, and that's where the children spend maybe 2-3 hours of the school time playing whilst waiting for their caregivers to pick them. So it's a significant problem. I remember discussing with Mr. Appiah about if we can improve the surface of some of the schools with some greening aspect, I don't know, maybe grass, but definitely it's a significant risk. So it needs to be addressed, and it has to start with education.
Right. Thank you very much. Prof?
I think I'll tackle the issue on how we can balance economic growth with environmental sustainability.
And please make your submissions as bite-sized as possible.
Very crisp, yeah. I think it's a very important question or issue that the gentleman raised. But in the submission of EPA, the CEO outlined a number of things that can be done in the industrial sector, so that at least we can clean pollution from that angle. But government should not be oblivious to the fact that in as much as you want to grow the economy, it also comes with some consequences for environmental issues like air pollution. And that is the more reason why we need to find a way to balance it. But how do we balance it? We need the data to show. As a country, we are bereft of air pollution data. And that is one area we have to invest. So that whilst we have monitors around, we'll be able to know that the industrialization agenda is creating more pollution, and then we can be able to address those issues. Yeah, so that's the key.
That's a very interesting point. For example, Prof's party says a 24-hour economy. What will that bring in terms of air quality, right? We have to look at all of these.
We have to interrogate all those things. I think we have to interrogate
Prof,
all those
at another forum, we'll have the time to look at some of those. Dr. Jabo.
Thank you very much. So I would briefly touch on the waste part, and then also briefly touch on some of the resources that we can think of. So I would first start off by giving props to the Green African Youth Organization, GAYO, Gaio won the Earthshot Prize for a project they are doing in Accra, which is co-funded by Clean Air Fund and Global Methane Hub. What they are doing is encouraging low-income households to segregate their waste. They then give them some remuneration when they give the waste to them. And so if you properly segregate your waste, you make some income. They also use the organic waste they collect to do compost and encourage them to do community gardens. So you also get some resources from that. In the end, this is only one of the many things we can do when it comes to waste. In our own communities, we can form a collective and find ways and means of utilizing what we consider as waste to even do organic compost or other things that can benefit all of us. It shouldn't be left to only the local governments or to any individual. It should also be something we find interesting or we find interest in to do so we can protect our environment and also protect our health. When it comes to the way we can think of, when it comes to generating resources to manage our air pollution, there are so many ways we can think of that we don't only need to depend on the things we engage in looking for money externally.
Right.
Internally, we should look at how we can ensure that we are raising the little money we can. In schools, there are lots of schools that have stopped burning their waste now. They segregate them and sell it, and use it to do end-of-year parties for the students. And it's a very good initiative.
Right.
In some schools, they segregate the organic waste and use it to do farming in the communities where they share the vegetables to the students. It's these little initiatives we can take on our own that do not require huge capital income or even external funding, but still goes a long way to protect our health and the environment at the end of the day. So, thank you.
Thank you so much. Please, one more time, let's put our hands together for the panel members. So this is where we're going to draw the curtains on the conversation. We're very grateful to all of you for making yourselves a part of it. Clean air is a business for all of us, including the students from the University of Professional Studies, Accra. Thank you for participating in this. Hopefully, there's a lot that you'll take back into your classrooms and to your friends. Spread the good message. Awula Sewa of the Eco-Conscious Citizens, all protocols observed, those from the World Bank, among others. I'd also like to acknowledge Desmond Apia, Country Director, Clean Air Fund, and we acknowledge the Clean Air Fund for actually doing this, helping us bring this. Vibeke Pedersen, Deputy Ambassador of the Embassy of Denmark in Ghana, we're grateful to you for your time. Let me also acknowledge our panel members, Dr. Sandra Kwating-Owusu, Senior Lecturer, Department of Child Health, School of Medical Sciences at the KNUST. Thank you so much. Professor Kofi Amega, Vice Dean of the School of Public Health at the University of Cape Coast. Thank you, sir, for joining the conversation. Dr. Elvis Tre Jabo, Portfolio Manager, Clean Air Fund or Breathe Cities. Thank you, sir, for joining the conversation. For those who joined the political interaction, we have Professor Martin Oting Abibio, Chair of the NDC's Manifesto Subcommittee on the Environment. Thank you, Prof, for joining. Courage Nobi is with the Movement for Change. He joined the conversation. And Issa Abdul Salam is the CPP's Ashanti Regional Secretary. He also represented the CPP. We've done this in our collective interest as citizens. We need clean air. It's a basic human right. So even as you go out there, that's why we titled it the National Dialogue on Clean Air and Election 2024. As you go out there to vote, think before you do so. My name is Benjamin Akapo. Thank you for joining us for this dialogue on Joy News and, of course, on Joy 99.7 FM and myjoyonline.com. Thank you for watching.